This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
Every so often on Delmarva Life, we address certain types of cancer, their symptoms, risk factors, and treatment options. Now, it could be prostate cancer, pancreatic, breast or lung, any type of cancer, really. Today, we're going to broaden our scope and discuss cancer as a whole. It doesn't matter what type of cancer. We just want you to know what resources are available to help you or a loved one fight it if you're ever faced with that diagnosis. For instance, did you know you can receive world-class cancer care right here on Delmarva? Dr. Thomas DeMarco is the Vice President of the Peninsula Regional Medical Group and the Medical Director of the Richard A. Henson Cancer Institute with locations in Salisbury and Ocean Pines. Thank you for joining us this afternoon.
Thank you for having me.
So in the fight against cancer, the Richard A. Henson Cancer Institute really is one of our best resources. Can you give us a history of it?
Yeah, I'll give you. It's very interesting. Actually, the Cancer Institute really started many years ago, back in the late 60s, frankly. We had a cancer registry, which we registered all the different cancers for the state. We were one of the first ones. And then the Cancer Center was developed with radiation oncology initially, and then medical oncology on top of that. And then finally, due to the generosity of the Henson Foundation, you know, the Richard A. Henson Cancer Institute came into being several years ago. And so now we house that all in one place on campus. So we have 2 radiation oncology machines, or linear accelerators. And we also have our medical oncologist office upstairs, and also where some of our clinics are, in addition to our clinical research team that we have in collaboration with Johns Hopkins. And
collaboration, that is key, because one aspect of your program is that you use a team approach with patients. You have many doctors working together? Right.
The days where one physician is going to be in charge of the patient only is really gone. So what we do is we have a multidisciplinary or team approach to taking care of cancer. So what we do is we have several different conferences depending on what cancer it is. For instance, we have a lung cancer conference on Tuesday, a gastrointestinal cancer conference on Wednesdays, breast cancer conference on Thursdays, and then on Friday we have a general tumor board. So in any of those conferences, what we do is we bring in all different specialists: medical oncologists, radiation oncologists, pathologists, radiologists, and our clinical research people that come in there that will let us know whether or not a specific case might really be a good example for a clinical trial, for instance.
Okay, all right. So sometimes with cancer, surgery is required, and you have the latest technology when it comes to surgery?
Right. We have over 20 ORs right now. We have we have 2 robots, which are the Da Vinci robots that do minimally invasive surgery. We also have what we call a smart room, so to speak, and they're with multiple fluoroscopy units there, so we can localize tumors better, especially for neurological disease. But we have about everything you possibly can have in our ORs, and we're very grateful for that.
And when you say it's minimally invasive, that means a shorter hospital stay, shorter recovery?
Yeah, exactly. A good example is when we take care of lung cancers, for instance. Lung cancers, traditionally in the older days, 5 years ago, we used to make big incisions, which were very morbid. They hurt. You know, really, patients were in the hospital for a long, extended period. Now, with very small little incisions, telescope is inserted into the chest cavity itself. Tumors are isolated and can be resected or removed right through these very small incisions. Patients sometimes are ready to go home the next day.
Wow.
Which is remarkable improvement.
That really is remarkable.
Right.
Okay, you mentioned clinical trials.
Correct.
Patients have access to that?
Right, yes. We have a collaborative agreement with Johns Hopkins Research, and basically what that does is it allows us to have access to all the clinical trials that Johns Hopkins has. So they get to accrue a patient and we get to accrue a patient, which basically means we get to count the numbers. So we get enough numbers of patients to make the trial itself statistically significant. So it's an example of when we're not really sure, in fact, no one's sure, the perfect treatment for a specific type of cancer or a stage of a cancer. So there'll be 1, 2, or 3 arms or 3 approaches to this. We'll measure that over a period of time with a certain number of patients and then figure out which one of those is the best, and then that becomes the new preferred therapy.
Do you think that we're making progress in the fight against cancer?
Oh, absolutely, definitely. I think what you have to do is you have to look at the individual cancers. If you just take a look at cancer across the board, we're doing well. But for instance, some statistics, breast cancer, we're approaching 90% cure rates for breast cancer right now, which is really excellent. Colorectal cancers are somewhere between 60 and 80%. We measure that in 5-year survival rates because if someone has a cancer, we never really say, we know for a fact you're cured forever, but we will follow them. But those are the rates that we see right now. And lung cancer and gastric cancers, we're not doing as well, but there's new therapies coming out all the time for that. So we're doing even better than that. What we really are looking for is on those cancers that we don't do very well with, it's usually because they present at later stages. So early screening will really make a big difference here.
All right. Well, let's talk about the future. What do you see in the future as far as in regards to cancer treatment and prevention and all?
I think probably the biggest innovation we're seeing right now is with immunotherapy. Right now, what we've decided and looked at is that most cancers are related to a gene or a DNA problem that we'll see. There'll be a gene somewhere that's not working correctly. So the pharmacy companies have done a lot of research and found these areas which we call targets, and they can actually target those areas and turn that cancer off, or even more so, turn our immune system on to attack the cancer. So that is not like chemotherapy, which is basically a toxic event, so to speak. So we're trying to utilize our own immune system to go after those cancers, which is what happens naturally anyway. It's just that at some point in our lives, our immune systems break down a little bit, and that allows or opens the door for the cancer to grow.
So you just turn up the immune system. Okay, as we mentioned, the Richard A. Henson Cancer Institute has 2 locations. You have, of course, Salisbury, and you have the newer one in Ocean Pines, and patients can actually take a virtual tour?
Yes, absolutely. Just visit our website, and I think I did that, as a matter of fact.
Yeah.
So they can go on our website and look under the Richard A. Henson Cancer Institute and take a look at actually we have virtual tours of both the on-campus one and also in Ocean Pines.
Yeah. Oh, such wonderful news in the world of cancer. Dr. DeMarco, thank you so much for coming in and talking to us. And of course, we'll have that information on our website, delmarvalife.com.
Well, thank you again for having us.
Thank